Hi, my name is Alice, and I'm going to present our work on domain adaptation and self-supervised learning for surgical margin detection. Breast cancer is one of the most common cancers in women worldwide. Early stage treatment of this disease is often a breast conserving surgery, where the goal is to remove the complete tumor while leaving behind as much healthy tissue as possible. One of the main challenges of BCS is to remove all the cancerous tissue in the first surgery. If the tumor is not palpable, the surgeon may accidentally leave behind a portion of the tumor, as you can see here on the right, resulting in a positive margin, which demands repeat surgery. The iKnife, seen as the device in the middle, is a modality that was developed to address the challenges surrounding intraoperative margin detection through real-time analysis of tissue. This image shows the ideal recognition software running and telling the surgeon that they have cut through cancerous tissue and created a positive margin. There are several others in this conference working on different aspects of this problem. My work is focused on the analysis of the iKnife data. To achieve real-time feedback of tissue typing, we first need to develop a recognition model. One of the main difficulties faced when developing a real-time tissue detection model with the iKnife is the collection and labeling of a training data set. Here on the left, we can see the cautery collecting a data point from a mastectomy patient. The destructive nature of the cautery tip and the sensitivities associated with affecting routine pathology assessment make acquisition of breast cancer burns intensive and time-consuming. We therefore propose a method of domain adaptation for classification. We use data from a more easily accessible tissue type, BCC or basal cell carcinoma, to train a model on the shared domain features of the iKnife. We do so by using self-supervised learning as a pre-training task and train it on the skin cancer. The central idea of relative patch algorithm is that there exists intrinsic positional relations among the divided patches of a sample. In the context of Reams data, the placement of those peaks at certain mass to charge ratios and the intensity relationships between the different peaks across the spectrum can be chemically significant. In other words, the low-level features that are learned during self-supervision are associated with signatures of biological tissue. An example of these features is the phospholipid peaks that occur when burning cell membranes, which would exist in all tissues. Through the reassembly of the shuffle of inputs, a model can learn to recognize shapes, patterns, textures of Reams data, which can then be optimized for classification. The convolutional layers are then frozen and transferred for a supervised classification step using our target domain of breast cancer. In this scenario, the pre-training on skin performs an ideal initialization and generalization of the weights and helps to avoid overfitting with our relatively small breast cancer dataset. This model achieved an AUC of around 92%. This two-part model allows for the influence of added diversity in the form of pre-training tasks to maximize the classification performance. In the future, we hope that this model can be expanded to other tissue types such as colorectal cancer to create a robust classification network earlier in the data collection process. Thank you.